Hi, everyone. I wanted to talk about recurrent miscarriages today. So, miscarriages in general are very difficult for a woman, a female, a family, parents to go through. Um, when you are someone that's having frequent miscarriages, what we call recurrent miscarriages, obviously that's very distressing, especially if you are unable to have a child or haven't been able to have a child. So let's talk about what a recurrent miscarriage is, at least by definition, okay? So it's defined as having two or more consecutive, meaning back to back, pregnancy losses before you get to 20 weeks of a pregnancy, which is about 5 months. So that is what the definition of a recurrent miscarriage is. Luckily, fewer than 5 out of every 100 women go through this. But the unlucky side is that most of the time it's unexplained. We don't know why it's occurring. If it's very, very early on, it's usually some sort of chromosomal mismatch when the fetus is or the baby is being created. So it's not something for most people that is contributing, that you're contributing to. So meaning that it's not something that you're doing, it's not an activity, it's not a diet, et cetera, that's causing that to happen. It's usually a chromosome mismatch of some sort. But if you are somebody that's having recurrent miscarriages, multiple ones, like I talked about, 2 or more, maybe it is a specific chromosome that needs to be tested in you or your partner that might be causing this. It could also be something like an anomaly within your uterus. Could also be something like medical conditions like uncontrolled diabetes or thyroid disease. So I say all of this to say, one, it's very common for a woman to have one or so miscarriages in their life, may probably not consecutively. Having children in between is something that's more commonly seen. But if you are somebody that's having miscarriages back to back, which we call the recurrent miscarriage, it's definitely something to look into, something where you and your partner need to go through some testing, where maybe some medical problems need to be addressed and controlled. It's definitely not something to take lightly. So if you are having a recurrent miscarriage, make sure that you see your OBGYN, you see your primary care doctor, you see your endocrinologist. Don't take this lightly and figure out what's going on, because you deserve to build the family that you want to build. So get checked out and find out what could be causing it. And make sure you have a good support system too, whether it is your physicians, your care providers, your family, your friends. It's really important to have a circle of people that you can talk to during this time. It affects your mood, it affects your mental health. So very important to make sure that you check in with that, check in with your support people as well while you're going through the process of not only having the miscarriages, but figuring out what's going on. And I wish you all the best.